The FDA today approved updated COVID-19 boosters for children as young as 5. National reports are showing that pediatricians are frustrated that many parents seem to be holding back. Less than a third of young children have had their 2 primary doses. This group now qualifying for the booster shot. Christian Garzone spoke to an expert at Golisano Children's Hospital today. And parents, he joins us now in studio. Christian, what's the latest?
Adam, those numbers you mentioned were put out by the CDC. Kids 5 to 11, just over 30% of that population have finished their vaccine series. This has medical professionals concerned. Now, while today might have been warm, winter is just around the corner, which means more people indoors and more chances for COVID to spread. Stephen Cook works in pediatrics at Golisano. Wednesday was a vaccine clinic for kids 6 months to 5 years old.
So most of the kids tonight are actually completing their primary series of the first shot.
Cook says the announcement Wednesday by the FDA to allow boosters for kids as young as 5 is to get ahead of the anticipated winter spike in cases.
This is now for the bivalent booster. This is the same booster that was already approved for adults 12 and older for both Pfizer and Moderna, except now it got approved for children 5 to 12.
The bivalent boosters are made to broaden immunodefenses against mutations of COVID and the contagious Omicron. National reports are saying parents are reluctant to get their youngsters vaccinated. Cook says that's concerning.
We know these vaccines are really safe and they're really effective at preventing severe illness.
Mr. Backus had his young twins inside the car. His family is for getting everyone boosted.
My wife is a pharmacist, so I don't have a choice. But more than that, we trust science.
Peter here says he's all in for boosters.
Whatever we can do to keep people from getting COVID.
Lonnie has not gotten any of the vaccinations and isn't wild about the idea for young people.
And I'm clean, you know what I mean? I'm a cleaner, you know, so yeah, I want to do that. I want everybody else to each his own, you know what I mean?
Cook says, look, he gets it. People want to be done with COVID, and we're no longer in the acute phase. Yet, it's still spreading.
But if one kid dies from it in our region, and we could have prevented it from vaccinations, you know, I think that's really tragic.
Cook says as we get closer and closer indoors, with many people now not masking, expect a cold and flu season that might resemble numbers from 2019. So get ready for that. Adam, back to you.
All right, Christian, thank you. And Cook reminds everyone if they do test positive for COVID-19, they should stay home for 5 days and mask up for 5 additional days after that.